Let's talk about Keppra or Levetiracetam in details. A few years ago, I met a young woman who had seizures, and then she was struggling with seizures for many years. And finally, we put her on the right medication that stopped her seizures completely. And within few months, her family sat in my office complaining that she started to change. She became angry, she became irritable, depressed, and short fused and short circuits all the time. So the same medicine that gave her seizure freedom was changing her personality or giving her side effects. So this is the medicine Levetiracetam or Keppra, one of the most commonly used anti-seizure medications today. This is the story of Keppra or Levetiracetam. We will talk in depth about what this medicine is, how to use it, how to dose it, what side effects can happen, and at the end of the video, I will tell you if I will ever prescribe Keppra again in my life or not. So I am Dr. Omar Danoun, the epilepsy specialized neurologist, and welcome to the Epilepsy Encyclopedia, where you can find all the information you need about epilepsy to better take care of yourself and your loved one. So what is Keppra? Keppra is the brand name, and the generic name or the real name of the medicine is called Levetiracetam. So what people do not realize is that this box or the brand name can change so much. Every company names it differently because it's a generic form right now, and it can have so many different names, but levetiracetam is the active ingredient in Keppra. What type of epilepsy levetiracetam or Keppra treats? So one of the reasons why Keppra is very widely used is that it is considered a broad spectrum anti-seizure medication. In simple words, it treats all types of seizures. It can treat focal seizures, it can treat generalized seizures, it can treat myoclonic seizures. Also, it is flexible in terms of age groups. It can treat elderly and it can treat young kids as 1-month babies. Also, this medicine is available IV, it does not need titration, so it is very, very easy to use medicine and works for all types of seizures. So that's why most doctors don't put lots of thoughts in treating seizures and they just give Keppra to everybody. And we will know today why this approach is quite problematic for some patients. What other conditions can be treated by levetiracetam? So Keppra or levetiracetam can treat multiple other conditions, not just epilepsy. It can be given to brain tumor related seizures, even it can be given to alcohol withdrawal seizures or even mania. However, we should be careful that sometimes it can cause psychiatric side effects that can worsen these conditions like alcohol abuse and mania. How does levetiracetam work? The way levetiracetam works is by targeting a specific protein in the brain. It's called SV2A. This protein is like the gatekeeper of electricity in the brain. It kind of regulates the discharges and the release of the chemicals that irritates the brain and causes more seizures. The glutamate chemical and neurotransmitter. So what Keppra does is kind of control the electricity and avoid excess electricity in the brain. So how to dose levetiracetam? The dosing of levetiracetam is so flexible and it is available in many different forms, which is very seductive for doctors to use. It's available in pills, tablets, it's available in IV form, liquids, for kids, and even in 3D printed pills. I did try it myself in one of the conferences, and it was like a magic trick. You put this pill on your tongue, you drink water, and then completely goes away. All right, let's talk numbers. I will keep it real simple. In adults, we start with 500 milligram twice a day, so 1,000 total, and then we can increase to 750 twice a day and sometimes 1,000 milligram twice a day. It depends on the seizure control and the patient side effects, and we like to have slow, gradual titration to make it easier for the body to get used to it, and the maximum dose is 3,000 milligram a day. In children, the dosing is more weight-based. It depends on the weight. So we will start by giving 7 to 10 milligram per kilogram in divided doses, like 2 divided doses during the day. And we can increase it slowly to reach the target dose of 42 milligram per kilogram per day. And the maximum dose is 60 milligram per kilogram per day. So it's all depends on the weight of the child. And the maximum dose, the same as the adults, is 3,000 milligram during the day. In elderly, especially 65 years and older, they are more sensitive to Keppra, and then we tend to give them smaller doses to begin with. Start usually with 125 or 250 milligram twice a day instead of higher dosing, because of these side effects. In people with kidney issues or decreased renal function, we tend to adjust the dose because the medicine is cleared through the kidneys. And if somebody has kidney failure on dialysis, the dialysis machine will filter out lots of the medicine and of the Keppra. So we always give an extra dose, a bonus dose after each dialysis. So if somebody is like on 500 twice a day, after each dialysis, we give an extra 500 to make up for what was lost. And in cases of liver failure, we do not have to adjust the dose. What to do if levetiracetam is not controlling my seizures? Well, there are multiple reasons why seizures do not get controlled. Most of the people will not have high enough dose, or it will not wait for long enough time for the medicine to work. We need to push it as high as we can, and to wait for maybe 2 to 3 months to make sure that the medicine took its chance to work. Other reasons why people have seizures is missing medications. So if you miss one dose of the medicine, it can be enough to trigger a seizure. So it's very, very important to be compliant on the medications, and missing medication doses can worsen seizures. Also, if you miss a dose, there is a steady blood levels, and then that will dip the blood levels in the blood, and then you can have a seizure because of that. So the recommendation is always make up the dose anytime during the day if you remember, and if you miss the whole day, at night you take the morning and night together. Always make up the missed dose. And if you do all of these things and still having seizures, then you might be having what we call drug-resistant epilepsy. It's a special form of seizures that does not respond well to medications. We might need even to do some surgical treatments, and I have dedicated multiple videos on that specific issue you can review. So it can be real tricky to know what is the best treatment option and treatment plan, and to do that I have offered a one-on-one consultation that you can do when we can go over all the case and tell you the best treatment plan. And to do this, check the link in the description below. All right, so what are the side effects of levetiracetam? This is the big one. Most of the time, the initial administration of medicine can have some side effects that can happen. Common ones like dizziness, sleepiness, tiredness, and headache can happen, and usually the body will get used to it. One of the big side effects for Keppra is the mood changes. People who are on Keppra, they can have mood changes, irritability, anxiety, depression, be angry, irritable all the time. They just get in fights for no reason whatsoever, all of that. And people even have a name for it. They call it Keppra rage, and even have suicidal thoughts, like all the anti-seizure medications. I have it. My name for it is called Keppranization. People are like really wired up because of Keppra. The risk factors for these behavioral side effects can be if somebody has a history of depression, anxiety, mood changes, or they are just angry people. I avoid it. Or they are using alcohol, or if they have family history even of depression, anxiety, that can increase their chances of having these side effects. So be very careful starting Keppra if you have any psychiatric history. Sometimes we can switch the medicine formulation to extend the release. It can ease up these side effects in some people. There are some more rare but serious adverse reaction like low platelets, angioedema, and just recently DRESS syndrome, which is an allergic reaction that can happen to people on Keppra. If we would stop levetiracetam, like all the anti-seizure medication, we have to stop it slowly, gradually weaning off the medicine, not sudden stop. The only time we suddenly stop the medicine if there is an allergic reaction. Can I drink alcohol or drive a car while taking levetiracetam? Initially, the medicine might make you dizzy and tired and sleepy, so it's better to avoid driving. And either way, if you have epilepsy, you should not be driving because of the seizures. Regarding to alcohol, people with epilepsy and levetiracetam, they can have interaction with alcohol. It's better to avoid it, and we recommend to not drink alcohol at all if you have epilepsy. Is levetiracetam safe in pregnancy and breastfeeding? The good news is that yes, levetiracetam is considered one of the safest anti-seizure medications in pregnancy, and the risk of malformation is really low. However, it can happen like all the other medications, however, but in a low risk. And we know that during pregnancy, because the medicine gets filtered throughout the kidneys, the filtration will increase so much, and we have to always measure the blood levels of levetiracetam during pregnancy and keep increasing the dose throughout the pregnancy. Sometimes we even double the dose or increase it by 2.5 folds or 3 folds even, because the body keeps releasing the medicine quickly. So very, very important to adjust the doses during pregnancy to make sure that the seizures continue to be controlled. And regarding breastfeeding, yes, levetiracetam is safe in breastfeeding. We only monitor for any sedation in the baby, which usually does not happen. Also, it is recommended to take folic acid along with levetiracetam so that you have enough stores in the body for any pregnancy preparation. Would I ever prescribe levetiracetam or Keppra to any of my patients? The answer is yes, of course. Levetiracetam is one of the medications that can be used and can be very effective. However, I will be very careful to not give it to anybody with psychiatric history. If somebody has depression, anxiety, mood changes, anger, I will avoid levetiracetam for these patients because I don't want to make them worse, because there are other medications that can make the mood better, like Lamictal or lamotrigine or other medication that can be positive on the mood instead of Keppra. And luckily now we have the second generation of Keppra, the second cousin, which is a newer medicine and has much less psychiatric side effects, and it is much better tolerated medicine. It's called Briviracetam or Briviact, and I have made a whole video about Briviact you can see in this video, and to learn everything about this medicine. And stay healthy and see you in the next one. Salam.